I'll start by saying, and I have said that, and I'll continue to say that, and I know we know the incredibly importance of having family to support and close friends to support people who are in long-term care, and that they provide such an important service within our care homes. We know, however, that right now it's still quite dangerous, and everybody has their one, but that whole community can be at risk. And many of us who are visiting in care homes may be at risk ourselves. So there's that whole dynamic that happens in the care homes, and we know they're very fragile and at risk right now. But our health authorities are looking at how can we make that happen in a way that's safe for everybody in the coming times when we get to that point.
Well, I think in short, Cindy, we're going to follow the medical evidence, the advice of our health team, Dr. Henry and others, to come to that solution. But I would say that I don't see it in the immediate. I'll just give you an example. We've had one care home that's in a very small period of time gone from no people passed away to 20. And that's the vulnerability. We've had outbreaks, not many, but outbreaks in acute care. And the key right now is to ensure that we continue to flatten the curve. And so part of, I guess, what I would say in all these cases, part of how we're going to succeed in renewing surgeries in the province, and we're doing so now, part of how we're going to succeed in bringing back the important visits that are an essential part of life in long-term care is that we continue to do the things, all of us, that are required. COVID-19 is a pernicious enemy in this, and the people who it targets the most effectively are people who are living in long-term care and acute care. This has been demonstrated not just in Canada but everywhere around the world. And so nobody wants to stop visits to long-term care 1 second longer than it's required. But right now it's still required, and we still have to do it, and it is heartbreaking. It is absolutely heartbreaking, but it is also absolutely necessary.
I'll start with Langley Lodge. Yes, absolutely. Fraser Health has a team. They do it for every long-term care facility outbreak, and it's the same strategy that we're using around the province. So it involves infection control practitioners and staff, medical health officers and nurses from Fraser Health to support the team and the work, make sure that all of the personal protective equipment is used properly and that people are doing what they need to do, and the investigation, trying to track down who's in touch with whom. So yes, that is happening at Langley Lodge. It's a challenging outbreak at Langley Lodge, and we've said this before. One of the most affected units is a dementia unit, and we know that it's incredibly challenging when people have dementia to be able to ensure that they're wearing a mask, that they're staying in their rooms and things like that. And that has been part of the tragedy that's happened at Langley Lodge.